Good day, first years. I hope you're all doing well and studying well as it is almost the end of your first semester here in Villas. Today, we'll be discussing our 11th lesson in HIS, which is about clinical data repositories. My name is Mafi Sweet J. Tubuhara, and I will be your lecturer for today. Our objectives for this lecture is to discuss the essence of clinical data repositories and its different types, to explain the advantages and disadvantage of having multiple views for patient medical records, and to discuss the clinical data repositories in the Philippines. The contents of our lecture is divided into five parts. 1. Clinical data repositories. 2. Standalone XML-based interface to integrate with any HIS. 3. Types of clinical data repositories. 4. Multiple views for patient medical record. And 5. CDR in the Philippines. Okay, part 1. Clinical data repositories. To start off, let's find out what exactly is a clinical data repository. So, a clinical data repository or CDR is also known as a clinical data library or data archive. It is a large database infrastructure containing several databases that collect, manage, and store data sets for data analysis, sharing, and reporting. These represent an aggregated database of clinical information which are searchable and exportable due to standardization. Now, CDRs exist in most laboratory institutions and can be in electronic or written format. They consist of 1. Laboratory results, 2. Diagnostic reports, and 3. Various clinical documentations. It integrates physician entered data with data from existing information systems, including laboratory, radiology, admission, pharmacy, etc. CDR is also where both clinical data and external data are assimilated. They can successfully depict the same sample across different points in time, both inside and outside the health institution. Okay, so these are the common information seen in a clinical data repository. Number one, we have the patient's demographics. It is the first bit of data gathered and consists of basic information of a patient: age, gender, color, ethnicity, income, name, allergies, occupation, residence, contact information, insurance information, and medical history are just a few of the many details it includes. Number two, we have primary the patient's primary care provider. So they are defined as physicians, nurse practitioners, clinical nurse specialists, or physician assistants, and they are the ones who provide, coordinate, or assist a patient in accessing a variety of healthcare services. Then we have number three, the medication list. It is the list of all medications a patient is taking. Number four, allergies. So, an allergic reaction occurs when your immune system overreacts to an allergen. An allergen is a foreign material that is generally safe for most individuals, but when an individual has allergies, their immune system fights it off like it would a virus or bacterium. So, in the CDR, the patient's allergies should always be written in it. Number five, we have the hospital inpatient visits. So, this is the records of people who have visited inpatients, complete with the date, time, name, and their relation to the patient. Number six, the emergency department encounters. So, it contains a patient's history of visits to the emergency department. Number seven, we have the outpatient practice visit. So these are records of people who visit patients who are not admitted but are in the hospital for prolonged treatment. Number eight, immunizations. So records of all vaccinations taken by the patient. Number nine, diagnosis. It contains all records of clinical diagnosis related to the patient. Number 10, procedures. So a CDR has the history of all hospital related procedures done on the patient. Number 11, laboratory results. So this contains complete list of all past laboratory tests and results. Number 12, social history. It records a patient's distinct health related habits and socioeconomic determinants of health. In contrast to things from the remainder of the medical and surgical history, items from the social history may be more sensitive and susceptible to socio political and psychological criticism. So, examples are a patient's smoking, alcohol, and recreational drug interests, occupation, and places they have visited in the past. Last, we have the vitals. These are measurements of the body's most basic function. So, the four main vital signs routinely monitored by medical professionals and healthcare providers include the following: number one, body temperature; number two, pulse rate; number three, respiration rate or rate of breathing; and four, the blood pressure. So, blood pressure is not considered a vital sign but is often measured along with the vital signs. Now, here is an example of your CDR or clinical data repository. Here we can see the patient's name, birth date, address, gender, just the patient's basic demographic. We see also the medical history, some documents related to the patient, the problems, medication, allergies, vital signs, of course, the procedures done to the patient, and some immunizations present. Also, we should not forget there is also a record of lab results. Now, all of these are information I mentioned before and should be included in a CDR. Okay, now let's talk about the advantages of CDR. Number one, it can help make more informed patient care decisions for healthcare providers. Number two, it gives a longitudinal view of a patient's medical record, which can assist in improving patient experience. And number three, information from prior test results and procedures help avoid redundant treatment. Now, for the disadvantage, there is only one. So, most CDRs are only integrated with clinical data such as lab results, diagnosis, and demographics, but overall patient satisfaction, the amount of time the patient had to wait before being treated, and other information not directly related to the patient care might be unavailable. Now, here we have other examples of data repositories. We have four: data warehouse, data lake, data marts, and data cubes. So, data warehouse are large data repositories that aggregates data from different sources or segments of an organization without the data being necessarily related. Number two, we have data lake. So, these are large data repositories that stores unstructured data that is classified and tagged with metadata. Number three, data marts, subsets of data repository, and it is more targeted to what the data user needs. So it is easier to use and more secure since they admit or they limit authorized users to isolated data sets. Number four, we have data cubes. So it is the list of data with three or more dimensions stored as a table. Now, how does the CDR work, or how does clinical data repositories work? So, the CDR aggregates clinical data from practices, hospitals, labs, and other healthcare organizations to create a longitudinal patient record that supplements the enterprise of electronic health records or e-health records. Now, as you can see here in the graph, information is sent from different certified EHRs and sometimes a web portal. So these authenticate trading partners, the single point of connection between different EHR platforms, and it is an enabler of standardized transaction exchange. So from the certified EHRs, they submit information to the clinical data repository. The CDR receives them, and it is it acts as a storage for information if needed again by the hospital information systems, or if they are inquiring whether a patient has a history or any history of such, uh, for example, maybe medications, lab results, or any past diagnosis, they can look it up through the clinical data repositories. Now, why do we need CDR? So, clinical data repositories provide access to information where it is needed, creating a one stop shopping environment. This allows the clinical staff to access a variety of patient focused information through a consistent and easy to use GUI. Now, what is GUI? GUI stands for Graphical User Interface. So access can be deployed through handheld devices, bedside computing devices, computers in physician office, or computing devices deployed at nursing stations. All right, part 2, standalone XML based interface to integrate with any HIS. So, according to Bergeron, CDR is a structured and systematically gathered storehouse of patient specific data, which is usually mirrored from a clinical application or supplemented with data from other clinical systems. Now, what is XML? So, XML stands for Extensible Markup Language. A markup language defining a rule set of encoding documents in both formats, that is human readable and machine readable. So, it is used for storing and transferring data on the web and in many other applications. Now, the different levels of integration of CDR depend on six things: one, locations; two, indices; three, catalogs; four, semantic translations or equivalents; five, syntactic structures; six, links to external information. Now, the level of integrity of a CDR will greatly impact its functionality. This is because there are a set constraints that determine how easily a person can make queries for any of its contents. CDRs vary on how they restrict the users who are granted access to the database. This now becomes a safeguard to uphold data security and integrity. Next, we move on to part 3, types of clinical data repositories. All right, let's start with number 1, study. So, a database that collects observations of a specific clinical research study. So, this encompasses research studies that include a patient's data information or observations depending on the cases or the topic involved. All right, we have number 2, the electronic health record. It is a database of observations made as a result of direct healthcare. So, this is the set of information that are recorded while inside the hospital. So, everything from lab results to doctor's diagnosis is recorded here. Then we have number 3, registry. So, observations collected and organized for the purpose of studying or guiding particular outcomes on a defined population. So, associated studies are either multiple or long term and evolving over time. So, the picture here uh, depicts some examples of registry clinical data repositories. Then we have number 4, warehouse, a repository that adds levels of integration and quality to the primary data of a single institution, so either research or clinical. It is to support flexible queries for multiple uses. It is broader in application than a registry. Okay, number 5, collection. So, a library of heterogeneous data sets from more organizations than a warehouse or more sources than a registry. So, it is organized to help users find a particular data set but not to query for data combined across data sets. Last one, number 6, federation. So, a repository distributed across multiple locations where each location retains control over access to its own data and is responsible for making the data comparable with the data of other locations. Okay, so let's move on to part 4, multiple views of patient medical record. Now, patient information from CDR can be extracted and used in assessing the occurrence or prevalence of certain diagnoses, lab results, or prescriptions within a set period of time. Now, it can access and analyze the number of times a particular procedure has been performed at all locations within a health system, and then see the aggregate amount per region, then by facility. Alright, clinical data repositories helps organizations transform large amounts of information from distinct transactional files into a unitary decision support database. Now, the dimensions used in such database are time, by year, month, week, or day, location, diagnosis, lab results or requests, and prescriptions. Now, all those unified data should need a way of it being presented. So, we use data visualization. So, data representation in the form of pictorial or graphical format. It is used to analyze trends and patterns from large data sets. It helps in simplifying a wide array of information, and it allows decision makers to derive analytical results from information presented visually. So, by visualizing all the data presented, making them more congested and easier to digest and understand, whether there is a trend, a pattern, or something else related to the data's information. Alright, then we'll move on to part 5, clinical data repositories in the Philippines. All right, now let's talk about the Republic Act 11223. So it is also known as the Universal Healthcare Act. It provides the legal basis for health reforms in the country. Now, all public and private, national, and local health related entities shall be required to submit health and health related data to PhilHealth, including administrative, public health, medical, pharmaceutical, and health financing data. Now, all health service providers and insurers shall each maintain a health information system consistent with DOH standards. What are these standards? Number one, enterprise resource planning. Two, human resource information. Three, electronic health records. And four, electronic prescription log. Now, the CDR in the Philippines is the NDHR, or the National Health Data Repository. It is where all health related entities will submit data to PhilHealth. This will address the critical challenge of collecting, integrating, and harmonizing existing health information systems and sources of data. This is also where submission and processing of health and health related data is considered an integral component of the healthcare system to promote better performance in the health system while ensuring data integrity or data protection at all levels of implementation. Here we see the Philippines COVID 19 registry. This means that during COVID 19, hospital information were gathered using the registry type of CDR. Now, what is registry again? It is where observations are collected and organized for the purpose of studying or guiding particular outcomes on a defined population. It is associated studies where they are either multiple or long term and evolving over time. As you can see here in the diagram, different hospital information systems upload COVID patient data to the registry where data curation happens. There is now data aggregation, data disambiguation, and the ensuring of data quality and integrity. After that, data is now sent to the dashboard and to researchers. The researchers now closely monitor COVID 19, and with the data that they have, they can give detailed updates on the number of new cases per day, number of fatalities, and etc. All right, so that would be the end of our lecture for today. Thank you for listening. It is a relatively easy and short lecture. Why? Because Clinical Data Repository is just your data library or archive, which consists of all the data a patient has gathered all throughout his or her life. So as long as you understand the relevance of the data of a patient or their clinical data repositories, then you will be fine. Don't worry, I will be getting the questions for my exam in my lecture only. Here will be the links and the book that I used for this lecture. And I suggest if you have a copy, then it would be good to read it. But it's okay, as all the information needed for you to study are in my lecture.